Hi, this is Aileen Iskandar. I'm here with Dr. Gilinov, the primary investigator of the surgical ablation of atrial fibrillation during mitral valve surgery. Thank you so much for joining us.
Oh, my pleasure. Thank you for having me.
Congratulations on a great trial. Do you mind sharing with us a little bit about the background for this trial?
Sure. The question is very simple. If you are doing mitral valve surgery on a patient who also has atrial fibrillation, what should you do for the atrial fibrillation? Surgical practice varies widely, with some people doing nothing for the atrial fibrillation, some people doing an ablation or a maze procedure. Our question was, should you do an ablation or should you just leave the atrial fibrillation alone?
Very good. That's an interesting question. And what did you find?
We found that if you do an ablation at the time of mitral valve surgery in people with AFib, you get far better rhythm control than if you just treat the mitral valve. So the upshot is, if someone's coming for mitral valve surgery and they also have AFib, do an ablation for rhythm control.
Very nice. And so in clinical application, this is what you'll be recommending?
Yes, the guidelines already say do an ablation, but the level of evidence was C. No one wants to get a C in school. You probably never got a C. We want to move that up to B or maybe A if we can with randomized controlled data. But one caveat, nothing in life is free. The ablation also is not free. People who got an ablation were a little bit more likely to have a permanent pacemaker implanted later. So we're investigating that further in terms of who gets a pacemaker, but ablation was associated with pacemakers.
Very good. Thank you so much for joining us.